Before you start watching this video, know that someone featured has depression. Try to find that person as you're watching. When you picture someone with depression, you probably don't picture people like this, smiling and laughing, talking amongst each other on a sunny day while walking to class. College is a huge transition into adulthood for adolescents, and that can often be difficult to manage. We suddenly have more freedom than we know what to do with. We're responsible for keeping up good grades on top of feeding ourselves, having extracurricular activities, having a social life, and potentially working and paying our own rent. Instead, you probably picture someone like this, mopey and alone, staring off into the distance and thinking about his sadness. The fact is, the depression is still a heavily stigmatized illness, even among college students. That means that a person living with depression might hide their symptoms and appear to be doing just fine. Stereotypically, the person that you think has depression would be the guy in the second scene, but it turns out that he doesn't have depression. He's just having a rough week. The girl in the middle of this group of friends is the person experiencing depression, but she doesn't know what to do to help herself. It can be incredibly difficult to reach out for help at such an overwhelming time. Depression, along with symptoms like sadness and loss of interest in typically fun things, can cause poor grades and isolation in students, but it's often portrayed in media as someone who is dramatic and suicidal.
Michael, what's wrong?
Everything's wrong! The stress of my modern office has caused me to go into a depression.
Depression? Isn't that just a fancy word for feeling bummed out?
Dwight, you ignorant slut!
Depression can be a major factor in overall well-being, especially in college students. The Depression and Anxiety Association of America states that depression is the #1 cause of disability in those aged 15 to 44 years old, which is the age range that typical college students fall into. This means that students with depression might lack interest in learning and have difficulty with seemingly simple day-to-day activities. According to the Centers for Disease Control and Prevention, suicide is the second leading cause of death in young adults, which includes the age range of the majority of college students. Around 1,100 college students die by suicide each year, according to Active Minds. Access to mental health services is vital in order to help students learn and achieve good grades in school and manage the stressors that come with adulthood. Unfortunately, mental health services can be incredibly expensive and inconvenient, and that is even more true with this group of people with limited time and money. Colleges have an obligation to their students to help bring access to mental health services to their campuses. One of the main resources offered at UAB is student counseling services. We interviewed some students around campus to hear their experiences and knowledge on access to these services.
I don't really know where it's located, but I do know where the student health center is. I don't know if they're in the same building though.
I do not know where it is located.
I believe in the education building on the first floor.
From my understanding, it is the Student Health and Wellness Center is where all of that would be located. Because that's where I've gone a few times.
That's the first time I've ever heard of the counseling center on campus.
I mean, I've seen a lot of stuff on campus, like come to counseling if you need it, but I'm just not really sure where to go to get it.
I didn't really know of all the services that the Wellness Center had for students.
I don't know that a lot of students know that that is available on campus.
I tried to make an appointment and they told me they'd get back with me. And I missed their call. We played phone tag for a little bit.
It says you have to call and tell someone what your issues are.
You have to plan very far out to get an appointment because the counselors do stay very booked.
The more information you can get out, the more outlets that you have, the better chance you have of helping those that need them.
There needs to be more counselors. Maybe there needs to be more staff that, can make it to where you can get an appointment.
During orientation, included with week you talk about the wellness center, include everything that comes with the wellness center, like whether it's counseling center. Is that part of it? Is that part of the wellness center?
UAB needs to offer more comprehensive resources in order to be more effective in treating depression on campus. Our community-level solutions offer policy changes that would improve access to mental health services across the university. The Hill Student Center would be a great central location for student counseling. Lots of students are passing through here throughout the day, and it's a location that students often use to study and hang out with friends. UAB has lots of students that also have full-time jobs that don't allow for daytime therapy appointments. Perhaps 1 or 2 days a week, they could offer appointments until 8:30 p.m., with a counselor on call throughout the rest of the week for urgent needs. Off-campus student services can build a network of local therapists off-campus and work with students to find one that fits their needs, so students can have a greater chance of timely appointments at no significant cost to the university. Another way to increase access as well as address the stigma of mental illness is to develop a mobile app that students can use at any given time. Students can use this app to message a professional who can help them through a crisis and point them to other resources as needed. The greatest challenge of these interventions is coming up with funding for added positions for therapists as well as funding for extended hours. Furthermore, outreach to the most depressed students will always be a challenge, but centralized locations and better marketing will make a great difference.